Learning outcomes. After studying this module, you will be able to know each personality disorder, able to understand the genetic, neurobiological, social, and other risk factors for personality disorder, able to evaluate the treatment of personality disorder. Defining personality disorder. Individual's personality traits, his way of coping styles, and interaction with social situations emerge during childhood and become established pattern of his behavior by the end of adolescence or early adulthood. These patterns includes his unique way of behavior and traits that characterize the person. Personality disorder are enduring patterns of perceiving, behaving, and dealing with social environment in inflexible and maladaptive way, which causes significant amount of distress and impairment in the social functioning of the individual. Clinical features of personality disorder. Our personality is accustomed to the demands of society. We live according to the society's expectations. Personality disorders are extreme, inflexible, and enduring patterns of behavior. They are unable to perform adequately their role in society, which was expected from them. These personality traits are distressing to the person and bring significant impairment in functioning. It causes problems in school, at work, and relationship with family members and friends. They seem to have no conscience. Whatever wrong they do in life, they have no any remorse for that. They have no regret. They do not learn from their mistakes. They repeat their maladaptive behavior. They cause damage to the others as well as to themselves. Other people in the society find their behavior unacceptable, confusing, and difficult to understand. The categories of personality disorder differ significantly in severity. In the milder cases of personality disorder, they generally function normally, but their family members, friends, and relatives regard them as troublesome and difficult to carry activities with them. Individuals of severe personality disorder do unethical acts which are against the society norms, and they are incarcerated in jails. Stressful and painful events of life triggers the development of inflexible and distorted personality patterns. Categories of personality disorder. DSM-4-TR personality disorders are grouped into three clusters on the basis of similarity of features among the disorder. Cluster A, it includes paranoid, schizoid, and schizotypal personality disorder. They are odd, eccentric, with unusual behavior ranging from distress and suspiciousness to social detachment. Cluster B, it includes histrionic, narcissistic, antisocial, and borderline personality disorder. Individuals with these disorders share a tendency to be dramatic, emotional, and erratic. Cluster C, it includes avoidant, dependent, and obsessive compulsive personality. In contrast to the other two clusters, anxiety and fearfulness are often part of these disorders. Two additional personality disorders, depressive and passive aggressive personality disorder, are listed in DSM-4-TR. Paranoid personality disorders. Individuals of paranoid personality disorder are suspicious of others. It is different from paranoid schizophrenia. The symptoms of schizophrenia, such as hallucinations, are missing in them. There is a less impairment in social and occupational functioning is found in them. Delusions are not found in them. Their suspicious nature spoils their relationship with family members, friends, colleagues. They are secretive. It co-occurs with schizotypal, avoidant, and borderline personality disorder. They have an unwarranted doubts about the loyalty or trustworthiness of friends or associates, reluctance to confide in others because of suspiciousness, bear grudges for perceived wrongs, and angry reactions to perceived attacks on character or reputation. Causal factor of paranoid personality disorder. There is no specific factors found that lead to the development of paranoid personality disorder. Psychosocial factors such as parental rejection, childhood abuse, and exposure to violent events are the most important causal factors for paranoid personality disorder. Low agreeableness and neuroticism are among the primary traits of the paranoid personality disorder. Schizoid personality disorder. Individuals of paranoid personality disorder have no friendly relationship with the others. They have no warm feelings and caring attitude towards others. They have no regard for the others' emotions. They do not enjoy pleasurable activities. Schizotypal personality disorder. They do not like to be friendly with others. They want to stay alone. Severe social deficits are found in them. They are poor in interpersonal relationships. They are eccentric in their behavior. They may suffer from transient psychotic symptoms under painful and stressful life experiences. They have paranoid beliefs and superstitious thinking, and they have cognitive and perceptual problems. They tend to have a lack of desire for or enjoyment of close relationships, little interest in sexual activities, lack of friends, indifference and to praise and sense of emotional detachment is found in them. Causal factor of schizotypal personality disorder. There is a little evidence to explain genetic factors those lead to schizotypal personality disorders. Early researchers view that schizotypal personality leads to the development of schizophrenia, but now theorists propose that no evidence found to establish a link between heredity basis and relation between these two disorders. Cognitive theorists view that people of schizotypal personality disorder might develop dysfunctional beliefs and maladaptive underlying schemes that lead them to view others as intrusive. They behave in a cool and aloof way. Antisocial personality disorder. Persons of antisocial personality disorder violate the rules of society and show no respect for the rights of others. They have aggressive patterns of behavior and involved in antisocial acts. They steal others' property and display such type of behavior which is unacceptable to family, friends and society. Their behavior is impulsive, they harm others, have no remorse for their act, they are irresponsible, lie and cheat others. Substance abuse is common in them. Many of them die an unnatural death from suicide or accidents. Such deaths may attribute to poor self-care, drug and alcohol abuse. They frequently fight with others and become irritable and aggressive. They have no plans for the future. Common behavioral patterns include a failure to conform to social norms with respect to lawful behavior as indicated by repeatedly performing acts that are grounds for arrest, deceitfulness as indicated by repeatful lying and use of like conning others for personal profits or pleasure, impulsivity or failure to plan ahead, irritability, aggressiveness as indicated by repeated physical fights or assault, reckless regards for safety of self and others. Causal factors of antisocial personality disorder. Genetic influences. Genetic factors contribute to the development of antisocial behavior. Investigators have found that whose parents are involved in cheating, stealing, criminal and antisocial activities, their children are reared apart from them. These adopted children later became criminals and they have the significantly higher rate of arrests, convictions and antisocial personalities. So genetic factors may present a vulnerability. Neurobiological influences. Individuals of antisocial personality disorder have found to low level of cortical arousal. That is why these persons are insensitive to punishment, fearlessness and high of thrill-seeking behavior. And brain structure does explain any abnormality. They scored same on neuropsychological tests as others. Psychological and social dimensions. Although little is known about which environmental factors play a direct role in causing antisocial personality disorder, evidence from adoption studies strongly explains the environmental factors that tend to make family members similar are important to the cause of this disorder. Children of antisocial personality disorder come from families with inconsistent discipline. It is not directly known that whether inconsistent discipline directly causes antisocial personality disorder, or it is conceivable that parents have genetic vulnerability to antisocial personality disorder. A factor implicated in personality disorder is the role of stress, and it was found that those who had been exposed to most traumatic events were most likely to engage in violence, illegal activities, lying, and using aliases. Histrionic personality disorder. Individuals of histrionic personality disorder behave in dramatic way. They are fond of acting all the day. They express their emotions in exaggerated way. They laugh loudly while watching a funny movie. They show strong emotions to other persons they have just met. Their speech is vague, lacking in details, and they are attention seekers. They are overly suggestive. Their behavioral patterns include a strong need to be center of attention, inappropriate sexual seductive behavior, rapidly shifting expression of emotions, use of physical appearance to draw attention to self. Etiology of histrionic personality disorder. Psychoanalytical theory explains their exaggerated emotions and seductiveness are seen as symptoms of underlying conflict. Seductiveness is encouraged by parental seductiveness. This theory proposes that their attention-seeking behavior is a way of defending their low self-esteem. Narcissistic personality disorder. Individuals of narcissistic personality disorder believe that they are special and unique human beings. They have lack of empathy. They are not sensitive to other people's needs. They have no compassion for others. They are attention seekers. They do the illegal acts to grab others' attention. They are exploitative and had no respect for others' feelings. They are happy when others give them attention. They are arrogant and think that they are very important. Their behavioral patterns include grandeur and a sense of self-importance, preoccupation with fantasies of success, power, brilliance, beauty, belief that she is special and unique, excessive need for admiration, sense of entitlement, arrogant and naughty behavior. Causes of narcissistic personality disorder. People of narcissistic personality disorder copied lack of empathy from their parents during the early childhood development. The child remained fixed, self-centered. It is more prevalent in Western societies because of social change. People are more individualistic, self-centered and competitive. Avoidant personality disorder. People with avoidant personality disorder avoid doing any responsible work because they have strong fear of criticism. They feel that they are incompetent. They avoid intimate relationships because they have fear of embarrassment and rejection. They view themselves as inferior from others. This co-occur with major depression in about 80% of people. Their behavioral patterns tend to include avoidance of occupational activities that involve significant interpersonal contact because fear of criticism or disapproval, unwilling to get involved with people unless certain of being liked, restrained in intimate relationship because of fear of being shamed or ridiculed, inhibited in new interpersonal situation because of feeling of inadequacy, views self as socially inferior. Etiology of avoidant personality disorder. Researchers have found biological, psychosocial factors that lead to the development of avoidant personality disorder. These people are born with tough temperament. Their parents may reject them, may provide them unconditional love. This rejection may result in low self-esteem. Dependent personality disorder. People with dependent personality disorder are unable to take care of themselves. They are dependent on others in decision making. They find difficult to live without the support of others because of lack of self-confidence. They try to find new relationships. When one ends, their behavioral patterns tend to include difficult making decisions without excessive advice and reassurance from others, and their need for others to take responsibility for most areas of life, difficulty disagreeing with others, for fear of losing their support, and doing unpleasant things as a way to obtain the approval and support of others, urgently seeking new relationships when one ends, preoccupation with fear of having to take care of themselves. Causes of dependent personality disorder. We are dependent on others for food, love, care and affection during childhood. If the child has faced neglect or rejection because of a death of a parent, this may instill the fear of abandonment in the child. The person may suffer from anxiety that he will lose people close to him. Obsessive compulsive personality disorder. People of obsessive compulsive personality disorder are extreme, perfectionist, preoccupied with rules and details. They pay so much attention to details and unable to finish work on time. They wish everything to be done according to the right way and their way, and they are so much involved in their projects that unable to give them to leisure activities, to family, to friends, and they are inflexible, stubborn and serious, especially regarding moral values. They find it difficult to discard worthlessness objects, and their behavioral patterns includes a preoccupation with rules, details and organization to the extent the point of an activity is lost. Extreme perfectionism interferes with the task completion. Excessive devotion to work to the exclusion of leisure and friendship. Reluctance to delegate tasks or work with others unless others do exactly the same thing. Rigidity and stubbornness. Etiology of obsessive compulsive disorder. Genetic and psychological factors were found to be the cause behind obsessive compulsive personality disorder. It may be because parental reinforcement of neatness and conformity. Psychodynamic theorists view that obsessive compulsive personality traits are caused by fixation at the anal stage of psychosexual development. Treatment of personality disorder. Personality disorders are relatively enduring and inflexible patterns of behavior which causes significant malfunctioning in the social life of the individual, and this disorder is difficult to treat. Psychologists apply therapies, use drugs to treat the patients. Persons suffering from avoidant personality disorder are given antidepressant drugs which reduces their social anxieties. Antipsychotic drugs are proved to be successful in treating the schizotypal personality disorder. Psychotherapy treatment may be given to the patients of personality disorder. This treatment may be given to the individual or in groups. This session may last for several hours a day. Cognitive behavioral therapy has been proved to be successful in treating the patients of personality disorder. Many persons of personality disorder recover from it over a time naturally. Psychoanalytical approach proved to be successful in treating the symptoms of histrionic and anxious personality disorder. Cognitive behavioral therapy. Cognitive behavioral therapy is used to treat avoidant and paranoid personality disorder. These patients are oversensitive to criticism. Systematic desensitization and social skill training is used to treat sensitivity. Social skill training teaches person how to be more assertive with others, and their negative cognitive beliefs and biases are explored and modified by the therapist. Summary. Personality disorders are extreme and inflexible personality traits which causes sufficient distress they can cause harm to others as well as to themselves. They cause dysfunction in the social and occupational area, family and interpersonal relationships. DSM-4 divides personality disorders into three clusters. The first cluster includes three personality disorders: paranoid, schizotypical, schizoid. The persons of paranoid personality disorder suffer from suspiciousness. They think that the others will deceive them and will take advantage of them. Individuals of schizotypical personality disorder show social isolation and they avoid close contacts, close relationships, and their behavior is strange and bizarre. Cognitive and perceptual distortions are found in them. Deficits in their working memory is found in them. People with schizoid personality disorder show no or little emotions and detached from the social world. The second cluster includes histrionic, narcissistic, antisocial and borderline personality disorder. Individuals of histrionic personality disorder are attention seekers. They are ready to do anything to gain attention. They dress up in an odd way to attract attention. They show as they are confident individuals, but from inside they need others' approval and acceptance. And persons of narcissistic personality disorder have grandiose ideas about their capabilities and importance. If other persons do not recognize it, they react with rage. Persons of antisocial personality disorders behave in impulsive and irresponsible way. They have regard for social rules and laws, and they are manipulative, and they do not learn from punishment. They also do brutal acts, murders, and borderline personality disorder individuals show pervasive patterns of instability in interpersonal relationships. Cluster C includes avoidant personality disorder, obsessive compulsive personality disorder, and dependent personality disorder. Persons of avoidant personality disorder are highly sensitive to their criticism. They show pervasive patterns of social inhibition, and other like obsessive compulsive personality disorder, they show anxiety and preoccupation with perfectionism and orderliness. And many factors seem to contribute to the development of personality disorder. Aggression may be due to the delayed gratification, a skill that most people require during the childhood development. Antisocial personality disorder may be due to abnormality in the secretion of neurotransmitters serotonin, and these persons show less reaction to negative stimuli such as punishment. These persons can bring harm to themselves as well as to others. Behavioral therapy seems to be fruitful in treating patients of borderline personality disorder.